It was discovered that pharmacy that are long expired.
Yes.
But they have put a different seal on the expiration tag.
Yes.
She just put it like that. I will show the original date. You are even talking about illegal medicine stores in the quarter. Go along hospitals. If there are 50 stores there, 40 are drugstores. Those are people who are not saying.
Prescription too. To know that the prescription is valid or not, first of all, you check the name of the prescriber. The name of the prescriber needs to be there with the number of registration.
When you are taking an unprescribed medication, either it's a wrong dose, either it is expired, either you are being treated for something else. There are many times we hear on the radio that there are hot medicines on our roads. But after destruction, the pharmacy continue to be there.
You just see something that they have put in, maybe white tablet, yellow tablet, they just put there and then they just write 2.
First, because the person might be selling in that drugstore, has a relation with them, that is a community member, can speak the dialect, can even borrow the medication to them. One more way.
Hello everyone, welcome to another episode of Africa Health Insight. In today's episode, we'll discuss issues related to consumption of medications without prescription in our communities. We won't continue without acknowledging your continuous support to our platform. Do stay with us and tell us areas that need improvement. Today, I have two of our colleagues. I have gentleman and lady. Please, can you introduce yourself?
Thank you for the opportunity that you have given me to be part of African Health Insight. Yeah, my name is Dr. Nembo Mabela. I'm a pharmacist and I'm also a focal person for supply chain management.
And to my right, I have
Mr. Osbert, Awah. I'm a nurse with specialty in epidemiology.
Okay. You're welcome, and we are glad to have you share your experiences and your insights into an issue that is really ravaging our communities, our brothers and sisters, our parents, our grandparents who consume medications without prescription, and most of the times they don't really understand the consequences of consuming these medications. Some of our grandparents, they are suffering from kidney failures, they are suffering from liver conditions, just because they have been continuously consuming medications that haven't been prescribed by a licensed prescriber. Without going detailedly, I think the other day we had a communique by the delegate indicating the authorized pharmacies that should operate legally in our Northwest region. So I would like to know from you, Nembo Mabela, like what is your experience and what are some of those medications that our loved ones, our parents, our grandparents have been consuming that are really disadvantageous to their health?
Thank you very much, Mr. Elvis. Most of the times, like an everyday routine, we have patients getting medications from sources which are not recognized by the state and without prescription. We have medications like amoxicillin, diclofenac, diazepam, amitriptyline, and many other medications that they present themselves most of the times to buy for maybe for their children or for themselves, which is not really a good practice.
Worked in the field, Osbert, you've had this experience of people getting medications without prescription. Like, what are those reasons they give for getting medications without prescription?
Then people pretend to be very busy. They don't take health serious. Health in Africa is always somebody is sick. I have noticed in clinical practice that because somebody comes to the hospital, he has tried a lot of remedies. Most of these remedies, one of them is that some of them must have passed through medicine store by the roadside and have medications that are not prescribed. You see medications that have gone off the essential medicine list. You still get them in the community because mostly these old people believe in them, especially analgesics for pains, medications for pain. You see somebody still asking that I need Indosit to manage pain. I need Botazone. I don't know what Botazone is. I just go up and learn about it. You enter the main market, our market today, most of these drugstores, you still find these medications there. Because even if they go to these profit-making pharmacies, legalized pharmacies, and they ask it there, it is not there, they know that that's what will help them. They still go back to the black market, and they will find it. Most of the kidney problems that we have now is because of the medication.
What do you think is behind this rise in the number of unauthorized drugstores?
People find sales of medication to be a money-making.
Yeah.
There's a committee that is in charge of illegal sales of medication. You see the medicine now, tomorrow you go back to the store, it's still active, which means that the person, except that you take the person to prison. No matter what you say. You are even talking about illegal medicine stores in the quarter. Go along hospitals. If there are 50 stores there, 40 are drugstores. Those are people who are not selling. Those are people who are selling it for business. Somebody is saying, you go there, they say, okay, mommy, take this one. I'll take this one. Until when they don't get well, you see them in the hospital. That's why when they come to the hospital, you ask, Mama, what have you taken? Either these medications are wrongly prescribed, or they are prescribed for no reason, or it's a polypharmacy. Somebody has about 7 different medications without any laboratory investigation done.
Somebody has written a name on it and put a stamp on the prescription. How do you verify the authenticity of some of these prescriptions, Mabela?
Okay. First of all, when you look at a prescription to know that the prescription is valid or not, first of all, you check the name of the prescriber. The name of the prescriber needs to be there with the number of registration in the medical council, and then with the phone number of the prescriber. And then we go further to check whether the medications prescribed matches with the diagnosis. And then we also check the posology, whether the dosing is appropriate and for a particular period of time that it has been prescribed.
What are some of those experiences you've had with packaging of medications in these drugstores? Tell us your experience with that.
The packaging of medications from drugstores is terrible. Let me just take an example with medications that come in containers that they need to count before they dispense. Normally, as a pharmacist or a pharmacy technician, we are supposed to write the name of the medication, the dose, the expiry date of the drug, plus the batch number. But most of the times from drugstores, you just see something that they have written, maybe white tablet, yellow tablet, they just put there, and then they just write 2 or something like that. You don't know, you cannot identify which medication is which medication. It's terrible. And sometimes too, we usually get underdose or overdose prescriptions on those things.
Looking at the structure of our health system, Osbert, how do you think we can manage the issue of consumption of medication starting from the basic level?
I think that administration should take it serious. Medications are poisons. These are wrongly used. That's why the adverse effect will keep seeing them in the hospital. So if there is no community sensitization, well, the first casualty are the users. When you are taking an unprescribed medication, either it's a wrong dose, either it is expired, either you are being treated for something else, that the person who is a casualty, the policeman who is supposed to keep the laws, is only there to come and see whether things are being done well, but the person who dies is you. So it should start with sensitization of the community before administration comes in, because administration will come to create the laws, but we know the country that we are in. It's an old history, something that has started time immemorial. It has not started today. It means that the effort you need an inter-service collaboration is not the activity of one person. The forces of law and order, the medical corps and partners, if they can create a forum where there is constant sensitization at all levels.
Yes, we know that people need to survive, but you cannot survive to the detriment of the general public.
Of the general public, because you ask yourself, how does these medicines reach? We don't have pharmaceutical companies in Cameroon.
Cameroon, yes.
We have very few of them. Here in Mabela, we will have all the medications in our markets. All over the place. How do they cross the borders? When we have authorities, the gendarmerie is there, the custom officers are there, everybody is there. But these medicines keep coming. There are many times we hear on the radio that there are hot medicines on our roads. But after destruction, the pharmacy continue to be there. It means that the porosity is there, and the administration knows that this is happening. We need authorities that can stand if our borders are well controlled. The people are there. We don't know whether we'll create some other people to go to the borders and ensure this. The very custom that we trained in those days have gone on retirement. The new ones have come. They are still there. The police people are there. They will still keep having them. So it's at that level.
Okay, to add to that point, I believe that for the consumers to actually get in contact with those medications, there's a place where they go to get the medication. We talk of accredited pharmacy or hospital pharmacy, or even the drugstores that they are going to. The consumer cannot get the medication unless they go to those places. But now, one thing I want to say is that for us in the medical field to assure quality, because sometimes even some of our accredited pharmacies, some might still get medication medications from unauthorized sources. So to assure quality, first of all, if we are working with our consciences, we need to get medications from authorized sources. Like the government has distribution companies of medications that they are registered. Sometimes you might see a company too which is registered, and the documents clearly show that this company is supposed to market consumables, not the medication itself. But you find them getting into the sector of medications and they use their documents to cover it. I don't know where they get them.
What strategies do you think we need to put into place to be able to curb this consumption of medications without prescription?
To me, I think that, like I said earlier, it should be a collaborative approach. Even the relationship that we have with our community patients. You can meet an old mother, you tell you how you will not go to a hospital. You prefer, it means that you already know some hospitals. They will tell you that I cannot pass. We have heard in our place that in those days, people were not coming to our hospital because of the behavior of nurses. Relationship of nurses to clients. Well, we have a pharmacy in the hospital. In those days, nurses were also buying from the community and selling at prices that are very toxic. So a mother who knows that I can equally have that type of medication may find it not necessary to come to the hospital. Like Mabela said, if we can, first of all, work on our conscience, know that when somebody is coming to the hospital, it means that there's a problem. Absorbing this relationship, not only seeing the patient, looking at the caregiver too, the type of care that you render, and the education that will accompany what you are managing. Therefore, our administrators, they can think that this medicine, because some of them, they are also thinking that it's money. They are at the borders. When you bring your medication, you give them money and they pass it. That's the root causes, bribery and corruption. Let's call a spade a spade. Yeah. Because people who are not authorized are importing medications, even more than those who have the license. If you go back to the community, then accessibility too. These professional pharmacists, like what Mabela is saying, go to whom there is none. That's a whole division. We don't have a professional. It means that you don't have a medication in the hospital, the whom DC hospital. Look at the roads that we have. Accessibility. If you can have the money, even at district level, you will not find the medication.
Accessibility to affordable medications is one of the issues.
Yes.
In the past, Norway Special Fund, Norway Regional Fund used to reach all the community. They brought this medication, make it available, affordable. Then the same cost in Awah is the same cost in Bamenda.
Yeah.
But now you don't expect a chief of center or a director of a hospital to pay his transport, come to Bamenda, buy medication, pay transport back to the health facility, and sell it at the same cost. So the cost of medication too at district level is also a problem. That's what sends some of these people to drugstores. Yes. And when they go there, first because the person might be selling in that drugstore, has a relation with them, that is a community member, can speak the dialect, can even borrow the medication to them. We have more way to talk to that type of person and say, no, don't mind those people. You go to the hospital, you pay this something that they can give you price that more, they complicate it. So you see the loophole. The technicians, first of all, are not there. You go to some health centers here, with no technical staff. Go to the community, especially with the crisis that we have now, there are health facilities with no staff. I mean, you can go to the region and verify what I'm telling you.
To conclude, what do you have any other thing to say in relation to this issue, Mabela?
Well, one thing too I would like to say is that talking about the aspect of sensitization, I believe that we need to let the community know and prioritize their health over other things. They should remove it from their mindset that getting medications from a licensed pharmacy is expensive, because that is one of the things that pushes them to drugstores. And when they go to drugstores, they can get, the consequences are so many. They can get expired medications, they can give them overdosage, underdose. They are not professionals that can actually give them counsel on how to take medications or the side effects of the medications.
Sometimes you even see that you go to a drugstore, they have removed the label of the package,
yes,
like the original label, yes. The medication inside is expired, and then it's a new label on the package of the medication.
Yes.
Have you witnessed that, and what are the consequences?
Typical example, there is one time that we had out of stock of fancy that but there was no way that we could practice.
Yes.
So we had to get fancy that from somewhere, and I brought it for Mabela to see whether we can manage it for a time moment while waiting for the government to do something. It was discovered that fancy that long expired, yes, but they have put a different seal on the expiration tag.
Yes.
She just peel it like that. I will saw the original date. Go to main market. There's no time that they are calling the main market that these are expired drugs we want to destroy. To me, that you cannot run a pharmacy even in our hospital without expiration. It's true, Dr. Nembo.
Yes, you cannot.
But a drugstore dealer will not accept any medication to expire. You force it out.
Well, thank you once more to our audience. Thank you to Mabela. Thank you to Osbert for coming and sharing these insightful discussions with us. It was great to have people on our platform, and hopefully we will still meet again to discuss other issues that are harboring in our community. Thank you.